The broadcast is now starting. All attendees are in listen-only mode.
So, good afternoon, good morning, everyone, wherever you may call in from. Welcome to join the LM webinar series with Tatiana Brandt. This series is called Ergonomics and Periodontal Instrumentation, How to Prevent Work-Related Injuries. This series consists of 3 parts. Out of the first part will take place today. It's about musculoskeletal disorders among dental professionals, hand and wrist problems. In 1 week's time, we will have the second part, and that is about how to prevent injuries when performing periodontal treatment. And the third and final part of this series will take place in 2 weeks' time, and that is on the topic, when should periodontal instrument be replaced, and working with sharpen-free instruments. As said, our speaker is Tatiana Brandt. She is a graduate from the School of Oral Health Care, University of Copenhagen, and she has been practicing dental hygiene for 16 years and worked for the Department of Odontology, Periodontology at the School of Dentistry in Copenhagen. For the last 8 years, she has also been working as an assistant lecturer at the School of Oral Health, Faculty of Health and Medical Science at the University of Copenhagen. Before I will hand it over to Tatiana to begin her presentation, I will go over a few practicalities. So you will be muted throughout the session. We will have a Q&A session at the end of the webinar. You will have the chance to ask questions, and there are 2 ways to do so. One is to type in a question on the right-hand side. You should find a field where you can type in your question. So either you do it that way, and we will read out the questions at the end. Or then also you may raise your hand. There's a raise your hand sign on the right-hand side, and we'll be able to unmute you during the time of the Q&A session, and you can then ask your questions directly to Tatiana. We will also have 2 polls during the session, but more information about those later. And now, without further ado, I'm going to hand it over to Tatiana Brandt, and we're very excited to have you here. And please go ahead, Tatiana, and start your presentation.
Me? Thank you, Dan. Can you hear me now?
Yes.
Yes. Hello, everybody, and welcome to this series of webinars about periodontal hand instruments. My name is Tatiana Brandt. I'm a dental hygienist and an educator. And the purpose of my webinars is to help you prevent work-related pain and work disabilities. Thank you for joining today, and let's get started. So today I'm going to talk about where the problem stands. You can find some information about me on this slide, and if you're going to have any questions about periodontal instrumentation during this webinar, you are very welcome to type them to me, and I will try to answer them at the end of this session. I wrote some articles last year for my dental colleagues, sharing some of thoughts about periodontal instrumentation. And while writing these articles and discussing them with my colleagues, I understood that we have a problem we don't really talk about. very important problem that doesn't get worked on naturally. And I'm talking about hand and wrist problems. As you know, sharp periodontal hand instruments are essential for the quality of our periodontal treatments and patient experience, but also has vital importance to us as therapists in preventing injury in hands and wrists. Repeatedly, however, I met dental practitioners at courses and trade shows which did not have any time for sharpening and accessing a few new scales or curettes, and thus replacing old, worn-down hand instruments. Well, the science writes about importance of instrument maintaining, but the praxis doesn't really change. And I believe that only by paying attention to this problem and involving the relevant people who care, who can make some changes about work environment, we can progress as we need to. So, in the first webinar, I want to ask you, why? Why should we care? This webinar is a result of my literature research on the topic. It is my personal experience with working with dull and worn-down periodontal instruments. My own and my previous students' work-related musculoskeletal disorders that motivated me to dedicate this webinar to the topic of dental ergonomics, and especially ergonomics related to wrists and hand injuries. Well, I know myself how serious this kind of injuries can be. And that will bring us to the next question that I will raise in the second part, which is, how do we prevent MSD, musculoskeletal disorders? I would like to share my knowledge and my clinical experience about periodontal instruments, which are actually designed to improve your ergonomics. I will demonstrate you some clinical photos and some modern techniques in order to reduce work-related hand and wrist stress. And the last part is about the question, when? It's not only about instrument sharpening techniques. It is mostly about considerations about instrument replacement. And this is nearly my favorite picture. You can probably agree with me that a lot of us work with instruments that are nearly as old as Egyptian pyramids. They are not really efficient anymore and very bad for our patients and our heads. I can't believe you can achieve good results with your periodontal treatment when you are working with an instrument like this one. But you will probably cause some damages to the patient's root surfaces and damage to your hands. In the third part, I will discuss the question about old instrument replacement and working with sharpen-free instruments, which are my absolutely favorite. But before I dive into the science, I want to tell you about my own story. Well, this is an old picture. The year is 2004. It's my last year at the School of Oral Health Care in Copenhagen. I mean, as a student. Can you see all these ergonomics mistakes I was making? Try to find 5. As many of you, I learned some basic things about ergonomics. I can't really say that I was motivated to use this knowledge at the beginning of my career. Probably because I didn't know that potential for work-related injuries was so high in our profession. That was 16 years ago. By the time I had been in private practice, my body started complaining. I loved my job and I was happy about working place, but I worked 10 hours per day with severe periodontal patients, trying to deliver perfect service and ignore all signals from my body. The muscles in my shoulders were constantly tight. I noticed cramps in my right hand and a tingling sensation in my fingers, just slight one. I didn't know the cause of these symptoms, and I felt ashamed and weak. You probably heard some stories like this before, don't you? And I kept my job, but continued my education and research, which helped me to understand that having good equipment that could protect my well-being was not just a want, but also a real need. I was one of the first in Denmark who used air polishing devices and sharpen-free instruments. My employers paid for the best dental ergonomics education for me and my colleagues, and that was very, very nice. Fortunately, the things are changing now. Educators at our school today are very aware of the importance of ergonomics. We pay a lot of attention to working with different types of grasps. You can see in this picture the first-year student working on the modified grasp techniques. And I'm going to talk a lot about some tips and tricks with using of grasp, penny grasp, and modified grasp in my next webinar. Why are we doing this? It's because we hope that we can help our students to prevent pain and to help them to the pain-free practice in the future. But in 2012, I still thought that I was alone with my problem. That's why I talked to my dental hygienist friends, and they all had some complaints about work-related musculoskeletal disorders. Some in back, some in necks, nearly all of us in hands and wrists. And that was just 8 years after our graduation. I didn't know the extent of MSDs among dental hygienists at that time. I thought maybe it was just about me and my classmates. And that's why I want you to ask the same question today. I want you to ask about your own experience, about your symptoms in hands, wrists, and fingers. And I believe it's time for the poll questions then.
Yes. So I've now launched a poll with a question, and please go ahead and answer the poll. So the poll question is, have you ever experienced work-related pain, tingling, numbness, and decreased sensation in your hands, wrist, or fingers? And we see answers are coming. I'll wait for a while to let everybody answer. Okay, I will close the poll now and share the results. So, Tatiana, are you able to see the results, or do you want me to read them for you?
No, I can see the results, so that's why I hope you can tell me about them.
Yes, so the results are 50% answered sometimes, 20% not so often, 13% often every week, 8% very often, and 9% never. So the biggest was 50% was sometimes.
Yes, thank you. But what we were expected, especially knowing that there are different kinds of profession is represented here in webinars. So let's go further, and thank you for your answering. Just to speak the same language, we need to be sure about definition about MSD. So what is MSD? A musculoskeletal disorders is a condition where parts of the musculoskeletal system, maybe muscles, tendons, nerves, are injured over time. It decreases quality of our lives and hinders us enjoying our jobs. It is quite difficult to enjoy working when it pains. So for many of us, MSD can be a reason for looking after another job, or in the worst case, losing our jobs. But the good thing about it, we can prevent it. Almost all dental work requires the use of the arms and hands. Therefore, most dental practitioners' MSDs affect hands, wrists, elbow, neck, and shoulders. So, why should we dental practitioners care about this? And why should we pay more attention to maintaining of periodontal instruments? Let's look at this picture. What is the connection here? The reason number one is because there are some ergonomics risk factors associated with periodontal instrumentation. Here you can see 1, 2, 3, 4, 5, 6, and 3 out of 6 factors is about instrument maintaining, which means some injuries can be prevented thinking about choosing of periodontal instruments. Factors that appear to be instrumental in contributing to MSDs in dentists and dental hygienists include fixed working position. It's staying in one position for extended periods. It's what I was told to do when I was in the beginning of my career, just sitting in 9 o'clock position. It's probably damaged my back. And excessive use of small muscles, what we are doing when we are scaling and root planing. Tight grips, very often when we use very narrow, very small instrument handles. Repetitive motions, when we are scaling, we are doing at least 300 strokes for one periodontal treatment. And our positioning changes when we are scaling posterior. Our limited movements and long-term static load on muscles. And here is another reference. It says that we have nearly the same risk factors, but you can see the number 3. And this reference suggests that small diameter instrument handles can be also a risk factor. Yeah. Well, there are even more, but let me explain them in my second webinar. This is just to introduce the most important risk factors which is associated with periodontal instrumentation. So, as you can see, the combination of these factors is more serious, especially when dental practitioners don't have adequate recovery time for their muscles due to overtime, lack of breaks, and lack of stretches. The dental health professional has a high risk of musculoskeletal injury when repetitive motions are combined with forceful movements, awkward postures, and insufficient recovery time in between treatments. Reason number 2 is very well explained in the following articles. This one was published in the British Dental Journal, and the aim of the project presented in this article was to determine the factors which have contributed to the early retirement of general dental practitioners due to ill health. It was known in 1999 that ill health retirement was 4 times more prevalent about dentists at age 42 years compared with medical doctors. Retired dentists were asked to answer the questionnaire, and you can see a total of 189 questionnaires were returned from dentists who were known to have retired because of ill health, but were not suffering from serious or life-threatening illnesses. And the average of age at retirement of respondents showed to be 51.5 years, and it is threatening. I'm 48 myself, and I'm being threatened to be retired in 3 years. And it was a ratio about 31 to 62 years. And another table demonstrates that a majority of respondents, 90% actually, considered that their ill health was work-related. So it's not because cycling or roller skating, it was work-related. The most common cause of ill health retirement was musculoskeletal disorders. You can see it here, it's 55%, followed by mental and behavioral disorders, 28%. It was like stress and burnout and depression. But the first among top reasons, it was musculoskeletal disorders. 63% of respondents state that they were able to keep working until their retirement, maybe when they retired to 31 or 62 years. 34% of respondents state that they would have liked to have been offered part-time work as an alternative to full retirement. And only 27% of dentists reported to have found re-employment since their retirement. It is about 1/3 part of participants. This project didn't investigate what kind of musculoskeletal disorders were most problematic, neither how things were for the dental hygienists or dental assistants. So, how does it look for dental hygienists? It showed to be a huge difference. One of the most serious injuries dental practitioners can suffer from is carpal tunnel syndrome. Of course, you have another one as tendonitis, but this is very, very serious, carpal tunnel syndrome, and very associated with dental practitioners. It's universally accepted that carpal tunnel syndrome is the clinical concomitant of compression of the median nerve as it passes through the very narrow carpal tunnel. And increasing evidence suggests that occupational factors, including forceful use of the hands, repetitive use of the hands, and hand-arm vibration, are etiological for CTS. So all these factors, you can see it's about periodontal instrumentation. It is all about dentistry. You can't really say that these risk factors will cause carpal tunnel syndrome, but there is a very, very strong association. So classically, but not necessary, practitioners with carpal tunnel syndrome will report symptoms like pain, numbness, or tingling sensation in the thumb, index, and the middle fingers. Sometimes in the ring finger, but only half of it, which is thumb side part. Some complain about numbness and tingling, awakeness at night by the symptoms, clumsiness and loss of grip strength. And they experience difficulty in performing tasks such as turning keys, opening bottles, or grasping door knobs, some small tasks. So if you can recognize some of these symptoms, you need to make some changes about your work settings. Be more concerned about instrument choices and basic ergonomics, because if the cause is ignored and the occasional symptoms can probably turn into chronic pain, which does not get better with rest and medication. The treatment will require a lot of rest, which means time out of work, and in many cases, surgery. And yes, sometimes it goes good with surgeries, sometimes it doesn't help a lot. So my main point is easier to prevent to treat this condition. Next paper, clinical evaluation and management of work-related carpal tunnel syndrome, described a median of 3 years of postoperative follow-up study. The investigators found complete relief of CTS symptoms in only 41% of cases and moderate relief of symptoms in 45% of cases, with 14 reporting no improvement. 67% of patients returned to the same job and 15% to a different job, while the majority of patients, 75, experienced 3 months or less of loss of work time. 8% of patients exceeded 1 year of time lost. This article is not only about dental practitioners. This is about clinical outcomes for all patients suffering from CTS. And the first recommendation for all these patients is a rest and stretch. But it's quite difficult when you are coming back to a job as a dentist or dental hygienist not to use your hands and use a lot of rest. So in spite of this article was about all professions, the risk factors and their relationship to carpal tunnel syndrome highlighted here are applicable to the periodontal instrumentation and thus to dental practitioners. You can see here, it's again the same we were talking about. It's repetitive work and forceful work and awkward postures and hand and wrist vibration, and the most important one, combination of these risk factors. That's why it's not surprising that the dental hygienists are mentioned here as a high-risk profession. We are on the top 10 list. Can you see it? When I first learned the statistics, I was stunned at how bad things were. Let's look at it together. Here are just 2 studies which prove the risk. The US Bureau of Labor Statistics reported in 1998 that dental hygienists ranked the first among all occupations in the United States in the number of carpal tunnel syndrome cases per 1,000 employees. 5-year follow-up study concluded another study that the painful and persistent symptoms related to carpal tunnel syndrome and other MSDs would lead to employees leaving the profession. So, what do you think? Shouldn't we be more concerned? Here is one of my favorite books and citation. The literature indicates that dentists and dental hygienists experience back, neck, and shoulder pain with an average incidence of over 60%, having experienced musculoskeletal pain. This citation is supported by 10 references, mostly from 80s and 90s. The last reference, however, is from 2004. You can see it here on the slide. And study was performed in Greece. A questionnaire survey was carried out among 430 dentists. Response. Question include data on a physical and psychological workload, need for recovery, perceived general health, and the occurrence of musculoskeletal complaints in the past 12 months. And 62% complained about chronic complaints, and about 30 had complaints at least in the last 1 month. Yes, some complaints lead to sickness absence, 16%, and medical care seeking, 32%. Here, wrists and hands complaints reported by 26%. So one is probably most cited study about ergonomics is this one. And the prevalence of MSD has been reported here to be between 62 and up to 93% for oral health practitioners. This review was performed in Australia. Notice that this study reports a huge difference between dentists, dental hygienists, and dental assistants, corresponding to different parts of body. The most prevalent regions for pain in dentists have been shown to be the back, you can see the numbers here, and neck, while the hand and wrist regions were the most prevalent regions for dental hygienists, 60 and up to 69.5%. Comparing with dentists, it was about 20–26%, depends on study. Did you know anything about it? A recent review of the literature concluded that dental hygienists report pain in the neck, shoulder, and hand-wrist regions more so than other dental professionals. These results are very alarming for the dental hygiene profession. I'm quite worried about it. You might say, these are the old studies and that things are different now, and you will be wrong. This literature review published in 2018 proved nearly the same. It was also a literature review. But now, let's come back to Copenhagen. The Danish study made by students from School of Oral Health Care in Copenhagen this year focused on the prevalence of pain in fingers, hands, and wrists among Danish private employed dental hygienists. You can see these young women, Amanda and Louisa and Emilie. They did a very nice job. I was very proud of them. It was just in the beginning of the pandemic, and it was very, very difficult to gather the questionnaire answers, but they did, and they got very nice results. 1,184 members of Danish Dental Hygienists Association were asked to answer the questionnaire, and the girls got 2,095 responded. That was very, very good result. Working as a private employed, not a public employed, was the only criterion for participating in this questionnaire. 67% said yes to complaining about different symptoms in hands, wrists, and fingers for the last 12 months. This self-administrated questionnaire was described by the questionnaire was distributed by the researchers with help of software we use in Copenhagen University's exact survey between February and March 2020. And the questionnaire involved information on the respondents' occurrence of musculoskeletal complaints in wrists, hands, and fingers, number of years in praxis, amount of patients per day, complaints with sickness absence as sort of medical care. Prior to the study, the questionnaire was tested 2 times for comprehensibility and relevance. And first as a pilot test on social media, and secondly among 3 dental hygienists with 15 years work experience and 1 dentist. They found no correlation between number of working years, number of patients per day, gender, systemic disease, and MSD symptoms, which is quite positive. So we thought that there must be some work-related factors that were preventive for the group that didn't develop pain. And that is very, very nice to think about. It's very positive. That would be interesting to investigate. Maybe we can do it next year. The fact that it would be interesting to include in the next investigation to explain the extent of the symptoms are how often and how excessive the respondent scale, what kind of instruments are using, Maybe it's air polishing devices or rotating polishing instruments, ultrasonic alone or hand instruments alone, or maybe a combination of these. Whether the instruments are sharp or dull, we are going to talk about another survey in our third webinar about sharpening habits in Denmark. It's very exciting. What kind of handle design is used? Because we know that these factors have a big influence on prevention of injuries. And I have just one slide left, and we agreed with them that we are making the last poll questionnaire. If you are then ready to introduce the next question, it would be nice.
Yes. So I launched the second poll, and the question is, do you find the study results surprising? Is this something that was common news for you or not? So do you find the study results surprising, yes or no?
Then I'm very excited to hear the I was working a lot on this literature study.
It's a few seconds still, so please go ahead and answer, and I will shortly close the poll. Okay, I'll close it and share the results with you. So these results were that 70% found the results surprising, so answered yes, that the results are surprising.
Well,
30% no.
Yes. Oh, no. Yes, thank you very much for answering, because I believe it's very important just to be aware of the problem to make some changes. And I'm going to my last slide, because I asked you at the beginning, why should we dental practitioners care about MSDs? The answer is because we have a risk to lose our job, and because the cost of illness is very high, both for practitioners, employers, and medical public service. And why should we pay more attention to maintaining of periodontal instruments? Because dull instruments create stress on clinician hands, wrists, arms, and shoulders, and sharp and ergonomically fitted instrument can prevent work-related injuries. And also because there are some other factors associated with periodontal instrumentation, which can be minimized knowing how. So today I know there are 3 approaches which helps you to bring work-related MSDs in your hands and fingers down. I will share this with you in my next webinar next week. Hope you can join me. There are a lot of dental products today designed to improve the ergonomics of dental hygiene practice. But how to choose? Let's talk about this next week. I will be very glad if my presentation today encourage you to ask me some questions. And thank you very much for your attention.
Thank you very much, Tatiana. So now we can open up for questions. So if you have a question, a reminder, you may type in your questions. On the right-hand side, there should be a field where you can type in your questions. Also, you can raise your hand, and thereby we are able to see and unmute you, and then you can ask your question directly from Tatiana. We actually do have a few questions already, and while you wait for your questions, I could ask those from Tatiana. So one of the question is that, ma'am, I have a doubt on how proprioceptive dentistry improve ergonomics. Please shed some light on it.
Can you repeat the question, please, especially the first part of it?
Yes, there was a difficult word in between. So, ma'am,
Yes.
I have a doubt on how proprioceptive dentistry improve ergonomics. Please shed some lights on it.
Okay, if we are talking about dental equipment, it's if I understand the question correct, it's yeah, we can talk about hand instruments, and here it's a very big difference and developing of periodontal instrumentation for the last 50 years, and very improved the points of instruments, very improved handles, and especially the weight of instruments. And all these things can really help preventing tight grasps and repetitive movements, and introducing of sharpen-free instruments for the dental practitioners is, I think, it's one of the most important things which happened. Another thing is rotated instrument. A lot of dental practitioners started to use air polishing devices. It is very nice progress because we are avoiding in this way vibration in our hands. LM dental represents just for example an ultrasonic device which don't have any vibrations at all. And I will be happy to share more examples with you about periodontal instrumentation in the next webinar, because I can probably talk 2-3 hours only about these topics. That I understood the question correctly.
Yes, thank you, Tatiana. Then there's another question. I have a doubt that do the dental assistants and lab technicians, prosthodontic, orthodontic, radiologists are at the risk of developing musculoskeletal disorders. Please shed some light on it.
Yes, thank you. Thank you very much for your question. I was nearly expecting this one. It was a study was published in the dental magazine in Denmark for, I believe, for something like 3 years ago. And the numbers were about 17% of dental assistants, 17, comparing with 20 as dentists and about 62 as dental hygienists. But still 17% complained about regularly chronic pain in wrists and fingers. But the cause of developing of these symptoms are different from the dental hygienists, because we are doing different tasks. In Denmark, a lot of dental assistants learn how to scale supragingially, and it's something new. So I believe these numbers are going to be changed if we are not paying attention to ergonomics. We need to educate both dental assistants and dental hygienists about working ergonomically correct, about this basic ergonomics techniques, but also about choosing the instruments which fit proper fit the patient and our practitioner's hands, and fit to the tasks.
Thank you.
It was this one. Yes.
Yes, and then there's another question. Does incorporate of lasers in treatment scenario decrease the incidence of musculoskeletal disorders among dentists?
Yes, you see, you have different type of lasers, and I don't have a big experience with lasers in my practice, because we don't educate about it in our school. But there are some studies, but I wouldn't take this. I'm not very competent to answer just this question, but if you are comparing scaling, so maybe that can take some pressure, but I wouldn't recommend. I'm not competent enough to recommend this because of lack of my own experience.
Okay, that's understandable. Thank you. Then there's a question: is there any study accomplished confirming number hours a dentist spends with hand instruments in 8 clinical hours? Is tactile sense in psychological or tangible? Depends on person. Oh, then the question ends. But I guess the first question was that is there any study accomplished confirming number hours a dentist spends with hand instrument in 8 clinical hours?
Yes. Thank you for your question. Yes, there are a few studies which describes how many hours dental practitioners, both dental hygienists and dentists spend on scaling. But it's a big difference between different countries and different clinics, and also dentists with different experience and specialization. But yes, you have this study I brought and described this study from Greece from 2004. It described a little bit about it. But you can write to me and I will be happy to help you with finding this study because I have it in my database. You can just find my mail and I can send you a reference to the study.
Okay, thank you. Then there's a questions, what percentage of MSD are due to improper instruments? Also maybe a study related question.
You don't have any articles which shows how the percent of MSDs depend, because you need to involve all these factors I described here. And it would be a very, very difficult study. But there are some studies that show that there is a very, very strong association with using handles with narrow diameters. And it's much better to use handles with wider diameters. And there are studies about weight of instruments and instruments design, but not study which bring in this percent and periodontal instruments together.
Okay, thank you. Then there's a question: which is more injured, the left hand and wrist or the right hand? Left side of body or right hand? As for me, the non-movable side seems to be more injured than the movable right hand side.
Yes, I believe the question is about dominant and non-dominant hands, because if we are talking about right hand practitioners, so our dominant hand, right hand, is gonna be more injured. For dental hygienists, but if you are talking about left-handed practitioners, so it's probably the left one, because this one is more affected by repetitive movements and tight grasps. But you can prevent injuries in your both hands doing being aware about avoiding these awkward postures and working with your hand, which is like one line with your arm, and just changing your position, avoiding this bending and flexing of your hand wrists, and working with proper periodontal instruments. And especially, and I'm going to talk a lot about it next time, using the proper grasp. The grasp technique, it's very, very important, and it helps to have a nice instrument because it's easier to maintain the proper grasp when you are having this like bobble design handles, especially for some practitioners with this hypermobility. So I hope it was the answer.
Yes, thank you. Can you shed some light on the efficiency of hand scaler, air scaler, and ultrasonic ones? Maybe that's
yes. Air scaling, it's yes. When we are talking about hand instruments or using hand instruments alone, ultrasonic devices alone, I'm also always a doubt, because the best result is achieved by a combination of ultrasonic and periodontal hand instruments. But I'm personally trying to avoid the rotating instruments, as rubber polishing, because I'm trying to avoid this vibration. So maybe I can't come with the proper study about air polishing. It's very, very effective, and it's very nice for patient, and I'm not a doubt that it's very, very effective and very time sparing for practitioners. But I believe that avoiding this vibration and avoiding this very tight grasps using air polishing devices, it can be the way to prevent hand and wrist injuries.
Thank you. Then there's a question: can you share a list of key articles on ergonomics? And I think here, if you, Tatiana, have a list and you're willing to share, that's something we could put together for the next webinar, and we could share it in our next webinar as a attachment to the
yes.
webinar.
Yes. Yeah, I totally agree with you, Dan, because it's all this things we are gonna talk next time. And if there are some interest, I share these references, because I have about 30 articles which have some recommendation about choosing the instruments, about preventing measures in practice, both for dental and dental hygienists. Yes, I would be happy to share these references with participants. We can do a list for participants next time. We can.
Okay, thank you. Great. Can regular exercise minimize the effect of possible MSD?
Yes, it's one of approaches, but exercise, it's not enough. Only exercise and strength exercise, it's not enough. It's needed to be in combination with proper stretches and regular stretches, and we talk about stretches just 8 seconds 5 times before every periodontal treatment. It can be very, very preventive. But these things, it just can't go alone, you understand. Exercise alone or stretches alone, it needed to be a combination of all these things. Proper periodontal instruments, proper working environments, in combination with exercises and stretches. This is the best prevention I can recommend.
Okay, thank you. How do we get through the MSD if affected?
Yes, it's a very complicated question. Yeah. How to avoid? It depends on practitioner. We are talking, of course, there are some general systematic diseases which can influence developing of MSDs. If we are talking about carpal tunnel syndrome, it can be just a bad luck. Some develop this kind when they are pregnant, when they have diabetes. So, but we can prevent for the most of practitioners by thinking about this working environment. And a lot of things can be prevented by scheduling of patient and just taking some breaks. And I'm not talking about drinking coffee at our working place 10 times a day, but just scheduling the patients and the combination of severe one with just regular one patients. It would be a nice thing to start with. Yes. And of course, considering how we are scaling and how we are working. And here it's a lot of tips to do, how you are combining this ultrasonic scaling with hands instruments, what kind of techniques you are using, how do you choose what type of periodontal scales apparatus you are choosing to begin with and to finish with, to prevent your hands and to be more rational about your periodontal treatment. So of course, a lot of it is about quality of our treatments, but the time is also a very nice thing to do. And avoiding many repetitive movements, it can be avoided just combining different techniques and the modern periodontal instruments. And the most important one, it's instruments which are always sharp. You see, when I instruct our students, I can easily come when they're doing their periodontal treatment with my sharpening stone and help them to sharpen these instruments just to feel it different, or taking sharpening free and see, just try to feel, and they can feel the difference at once. And it's also, wow, it works. And it's just a little thing, but for me it's very important to point that we need to always work with sharp instruments. It's the best way to prevent. That's why I'm working with sharpen free instruments. I prefer this. Thank you.
Thank you very much. We're reaching the end of our time, and now I think we answered all of the questions that we have here. Is there, Tatiana, any final words you would like to say before the end here?
I just hope that I caught your attention, and there are some who want to join me next time, because next time I'm very excited about next time. I've got a lot of very nice clinical photos and some nice pictures to illustrate. So it's gonna be like more up to discussion how we are doing things, and like more practical recommendation. So this one is just about awareness, about putting a lot of focus on the problem, talking about how the problem stands. But next one is my favorite part. It's about periodontal instrumentation and about how do we do to avoid this musculoskeletal disorders. So I hope to see you next week or hear you next week.
Yeah. Yes, as do we. So thank you very much, Tatiana, for your presentation, and thank you everyone who listened in, and thank you also for the question that you asked. And as Tatiana mentioned, we hope to hear and see you all online next week as well when we have the second webinar. So thank you everyone. Have a good rest of the day.
Thank you. Thank you, Dan, for your help. Thank you.
Bye.
Bye.